you were saying it's only 5% of women are taking hormone replacement therapy.
Yeah, less than 5. It's like 4.2 or something.
Is
It's
that even the
absurd.
right word? Hormone? Because I know there's menopause. Let's break this down. There's menopause
Yeah.
therapy, hormone replacement therapy. I mean, what is the right way to communicate this? Because it is confusing.
It's this is an ongoing discussion. So the official name is menopause hormone therapy, but they're basically, and I don't tend to use that as much, although I do sometimes. The official name is MHT. That's for treating women in menopause. Um, HRT is the kind of older name. A lot of doctors still use that. I sometimes do, but there's a lot of discussion because like I use these hormones, not just in menopause, and I also don't just use estrogen and progesterone. I'm also using testosterone and thyroid and melatonin and like other hormones. So I tend to say hormone optimization therapy, but honestly, there is no consensus about the best way, except this MHT is the sort of standard way that the medical societies say.
I think the hormone optimization is a lot better. You're onto something there.
Yeah, I like
That
it, and
will
it's and I
capture
can say
more
then I can say I'm a hot like a hot doctor, which is kind of fun.
that
HOT, hot.
that will capture the next generation better, just having the word optimize.
I think so
And
too, and I also I treat men too, and that I treat men with hormones. And so I
I
being able to be a little bit more broad optimization and not just treating this very narrow
yes.
menopause women group.
That's awesome segue. That was one of my other questions. So we talk about, it's women mostly talking about all of our hormone issues and everything, which is great. And that's, I think, a very positive step forward based on even what happened a couple of generations ago. But for men, what are you seeing right now? And what, even just, if you are listening and you're a concerned wife or spouse, what are some of the things that men should be looking for and how are you treating men?
So for men, it's low testosterone is the main hormone that we worry about in men. Certainly, men also have estrogen, but low testosterone. It's we know that testosterone levels have gone down over the last 50 years as a population for men. That they've gone down quite a bit, and this is probably a combination of just being less healthy. Not exercising, not lifting heavy things, not sleeping as well, more stress, plus endocrine disruptors in the environment. So you have all of these things kind of coming together as the perfect storm that is resulting in men's testosterone trending down. And testosterone is really important for both men and women, but in men we know that lower testosterone levels are highly associated with higher mortality rates, with higher heart disease rates, with higher problems with brain cognition, et cetera. So and testosterone is used to make estrogen. So if you don't have enough testosterone, you also don't have enough estrogen for men. So usually we're replacing testosterone or we're giving medications to help your body to make more testosterone. One thing that's great about testosterone is it does respond well to lifestyle changes. So for men who are younger, especially, their testes still work. If we make changes to lifestyle, oftentimes they can make their own testosterone, with some effort, which is a little different than women. In menopause, once you lose, estrogen, progesterone, it's not a lifestyle thing. It's just your ovaries are not functioning kind of thing.
So if you saw a male that had low testosterone and was, let's say, 36, it's like young enough, what would you say are the first things, just the first handful of lifestyle interventions that he should make?
So the first things are lift heavy weights,
Mhm.
get a little sun so you have some vitamin D. Make sure you're sleeping well, 7 or 8 hours a
Mhm.
night, ideally. Reduce stress. High stress is a cause of low testosterone for sure. If possible, reduce some belly fat and
Yeah.
visceral fat, which will also help. And then make sure you're getting some of the micronutrients like vitamin D, selenium, some magnesium, some of those things to make the testosterone.
All of these little choices, obviously food is such a fundamental aspect of it as well, but all these little choices that are adding up into what, you say it perfectly, which is this perfect storm. And so I always say it's not productive to get stressed about our stress levels and it's not productive to get overwhelmed. It's really just, okay, what are the two or three things? And even if it's just one, just change one thing a week. And before
Yeah.
you know it, I mean, that's really, especially when it comes to hormone health, I think what makes the biggest difference.
Yeah, absolutely. I think that it feels very overwhelming if you try to think about all the things that are like coming at us, that the microplastics and the endocrine disruptors and the xenoestrogens and that, like, it's stressful. And I totally agree. I think that stress is not going to be helpful. And the best thing to do is try to really approach it from I can do what I can do, like consistency, moving towards better every day, but understanding that it's a pretty big task to be perfect, and most of us aren't.
Yeah, and I mean, even just one thing that I always say for men and for women is sleep. If you that's like the
Yes.
first thing because if you're not sleeping, then all of these other changes are gonna feel way too overwhelming. Everything is gonna
100%.
feel
When I was after I had my kids, I went back to after I had my I have twins. After I had them, I went back to the gym at I think I was like 2 months out from having them. I had a C-section. I was like, "I need to go to the gym." And I hired this personal trainer who I just met at Gold's Gym, and I was going like twice a week to the gym, and I was like, gonna get I was gonna lose weight and all this. After a couple weeks, she looked at me and she goes, "Amy, are you sleeping? You need to be sleeping." And I was like, "Well, I'm sleeping like 2 or 3 hours, but like I don't have, I have twins and they're always up." And she looked at me and she said, "If you don't get sleep, then nothing that you do here at the gym is going to make a difference.
Yeah,
You need to use this time to sleep and
yeah,
come back and see me in a few months when you have enough sleep, and then we'll work on your exercise and all of those things." And I thought that was so smart because she was
yeah.
completely right.
No, it's when our body detoxes, it's when our body replenishes itself, and again, just from a mental health, all of kind of the overwhelm and the anxiety of all these other things, if you are missing your periods or have low testosterone or having fertility issues, unfortunately, that's a lot of our friends these days, right, that are trying to
Yeah.
have children, and all of that, can't even begin to be solved without sleep.